Welcome to Neurology Disease Deep Dive. In this episode, Dr. Beth McQuiston, Medical Director at Abbott Laboratories, and Dr. David Okonkwo, Professor of Neurological Surgery, Clinical Director of the Brain Trauma Research Center, and Director of the Neurotrauma Program at the University of Pittsburgh Medical Center, discuss evaluation and advances in the evaluation of traumatic brain injury. Dr. McQuiston is talking with us today on behalf of Abbott, which is sponsoring this podcast. Dr. Okonkwo is a physician scientist whose research on blood biomarkers was instrumental for advancing traumatic brain injury biomarker diagnostics.
Hello and welcome to Neurology Disease Deep Dive. I'm Wendy Terry, publisher of Practical Neurology. Today we'll be talking about evaluation of traumatic brain injury, or TBI. Many people refer to a head injury or a bump on the head as a concussion, but clinically this is referred to as TBI. These terms can be used interchangeably.
To explore concussion evaluation, care, and recent advances more deeply, I am joined by Dr. Beth McQuiston, a neurologist and medical director at Abbott, and Dr. David Okonkwo, neurosurgeon at UPMC in Pittsburgh. Thank you both for joining me today.
Dr. Okonkwo, I'd like to start with you. Are there difficulties with the current concussion diagnosis process, and how do those difficulties impact the patient, the attending physician, caregivers, etc.?
Wendy, thank you for having us today. It's a pleasure to be here, and this is an exciting topic for us to discuss. I think it's important to point out that traumatic brain injury is one of the major public health problems in the United States. Each year in the United States, 4.8 million people seek an evaluation for a traumatic brain injury, and 2.8 million people are ultimately diagnosed with a traumatic brain injury. The incredible part of this is that we have never achieved perfect agreement amongst clinicians about what a concussion is, what a traumatic brain injury is, and how to diagnose these entities. So we're left with this pretty significant period and an entity of uncertainty. We all can diagnose a traumatic brain injury that's quite severe, and a CAT scan shows that someone has suffered a pretty significant injury. But it's the people who are conscious and talking to us that are a much bigger diagnostic challenge. And that process today is, in fact, rooted in a clinician's feeling about the situation. Now, those feelings are colored in by some testing that's done, and we can evaluate someone's neurologic exam, we can look at their balance system, we can test their vision system. But at the end of the day, the diagnosis is rooted in a clinician's feeling about the situation in the overwhelming majority of circumstances. When a diagnosis is based in feelings, that leads to inaccuracies and it leads to more uncertainties. It's really underwhelming for both the clinician and the patient.
And Dr. McQuiston, let's go to you now. How can blood-based biomarkers help improve a physician's ability to evaluate a concussion?
We know at least 69 million concussions happen globally per year. And to echo what Dr. Okonkwo said, it's very difficult to assess what's happening in these folks. You have people that have sustained a traumatic brain injury. And a lot of times with that, they have amnesia, or they can't recall the event, or they're not feeling quite themselves. And what we've heard from clinicians globally is that they needed an objective way to assess concussion. And this blood test is now available on a small portable device, as well as a large system to run these labs. And it really offers the ability to have an objective, rapid way to assess what has happened in the brain. When you look at all the other disease states, or if you look at all the other organ systems in the body, say, for example, the heart, the liver, the pancreas, they've all had blood tests to help assess what was happening with them. And now we finally have a blood test to help assess the brain.
This is really one of the most interesting aspects of the disruption in what's happening in the space of traumatic brain injury. 20 years ago, this was considered magical thinking. The concept that a blood test could teach you whether the patient in front of you has sustained a traumatic brain injury, no one believed it. An incredible amount of work has been done over the last 2 decades to get us to this point. We had a really important moment back in 2018 when the first FDA clearance of a blood test for TBI occurred. And then over the last 6 years, there has just been an explosion of data and research and focus and attention on the concept of a blood test for traumatic brain injury. Several additional victories have been achieved since 2018 and that first blood test to get to the point that Dr. McQuiston is talking about, where there are now handheld devices where blood can be drawn from the patient in front of you, processed onto a cartridge, and then within minutes, you can have really important information about the health status of the patient in front of you. That can be complemented by the core lab tests that can also be ordered in these situations. But when I talk about disruption in clinical practice, I think one of the real gems of this story is that this technology has already been adopted by our nation's military. And the Department of Defense has already forward deployed these portable handheld devices to allow medics and clinicians far forward in these overseas conflicts to be able to evaluate the wounded warrior and make critical, important clinical decisions about those wounded warriors to make those life-saving decisions for service members across the globe.
And I want to echo that, David, that this technology came out of the United States Department of Defense. The Department of Defense came to Abbott in 2014 and said, we have this amazing discovery to help assess brain injury, and we want you to put it on your platform. So that's where this came from. And we put 300 of our scientists and worked on this diligently for 7 years. And we routed this through the FDA, which is the highest bar in terms of regulatory clearance. And then we've also sought and gained regulatory clearance across the world.
And Dr. McQuiston, I'd love to move a little bit to how the blood-based biomarker tests are run. Can you discuss or explain a little bit how the iStat and the Alinity I systems work for the TBI biomarker tests?
Well, I'm glad you asked, Wendy. Sometimes you need a hammer, sometimes you need a wrench. And in this case, for one of the platforms, it's a portable device that is handy. It's a little bit bigger than a universal remote control. And you can draw the patient's blood. You wait 15 minutes and you get readings on 2 brain proteins down to the picogram level, which is incredible. Who would have thought? It really does feel like magic. It's incredible. And then for other situations, you need a core lab platform. So when you traditionally go in and see your doctor, or if someone's in the hospital and you send the blood work to the lab where you run lots of labs very quickly, that's called the core lab. And why you need that is if you have mass casualties, you've got a busy ER, you need an expanded range capability. It's wonderful to have the core lab capability. So that way we have flexibility for the providers if they need a smaller handheld device that is more portable or a bigger box to run multiple samples at once. They're both FDA cleared for the Abbott TBI blood test.
Excellent. Dr. Okonkwo, can you highlight some use cases?
Absolutely. There are the opportunities for deploying this blood test now, and then there are all the exciting possibilities that are coming through the pipeline down the road for this technology. I genuinely believe that this is going to change the practice of medicine for, again, a health entity that is a major public health issue in the United States. Millions of people every year in the US are diagnosed with a concussion or traumatic brain injury. We already talked about how that is largely a subjective process currently, where you gather the patient's symptoms and history, and then you complement that with a little bit of objective testing, but we don't have the precision that a blood test provides. This has enormous impact everywhere. At present, one of the challenges for the efficiency of the emergency department is that the ER physician really has a low index of suspicion about the patient in front of him or her with respect to a traumatic brain injury, but also knows that they have to guard against some pretty significant potential problems inside of the head. So they end up getting a CT scan. That's expensive, that involves radiation, and it also involves time. It's much more effective for that clinician to be able to order a rapid blood test that can really provide the powerful information that says, you know what, you don't need to worry about this patient. The likelihood that this patient is going to have a positive head CT is extraordinarily low. So right then and there, you can start to separate out the patients where you have to either be worried about a potentially life-threatening problem or not. And if you can get over into the, you know what, we're not worried about a life-threatening problem going on inside of this head, that dramatically changes the efficiency in the emergency room. Once we get more experience and once we get further down the development pipeline of these biomarkers, we're going to see them used in a host of other circumstances. One of my dreams is to see this deployed on the sideline. We already talked about ways in which our nation's military is starting to adopt this technology, but they also have much grander intentions for these tools and technologies as the development pipeline matures. We'll see them make their way into urgent care centers, into primary care physician offices, into training rooms, because who doesn't want a test that gives you a numerical answer about the patient in front of you and what that recent injury means for that patient's health status?
The other thing I want to add here, just to make it clear, Wendy, is that your brain protein should be in your brain, not in your peripheral blood. So we're looking for a low number. You want this number to be low, like a golf game. You want it low. You don't want to have very high numbers on this test. That means that those brain proteins leach into the peripheral blood and they're at a high level. For a simple analogy, I like to refer to it as piñata candy, right? So you hit the piñata, the candy falls out, you measure the candy. In this case, you want it to be low. That gives you a green light that the patient's okay. And if the brain proteins, if the test results are elevated, that serves as a warning bell that further evaluation is needed. So low is good, high could be a problem.
We are very fortunate to be standing on the shoulders of giants, individuals who devoted their lives, their careers in the scientific pursuit of getting better for patients with traumatic brain injury. And the value of these tests is rooted in exceptionally strong science. The two proteins that are being measured, one is called GFAP, or glial fibrillary acidic protein. The other is UCHL1, which is ubiquitin C hydroxylase 1. We have decades of research that teach us what these proteins represent to the injured brain. And again, like I said, it was magical thinking 20 years ago that you could actually detect them in blood and make inferences about what was happening in the brain, but it turns out it's true. And so we know that these two proteins are meaningful when it comes to brain health or brain injury. And the fact that we can now measure them through blood test is what the game-changing moment is for the history of our field.
Thank you both for that. Dr. McQuiston, Dr. Okonkwo talked a little bit about this already being used by the military. So I'd love to know, where are the tests being used currently, geographically, so US and Europe, for instance, but then what are the plans to move them out beyond military?
First of all, I want to take this opportunity to thank our nation's finest. Thank you to the United States Department of Defense. They're keeping us safe in so many ways, and in this case, they're keeping us safe with their breakthrough discoveries in the medical technology field. So thank you, thank you, thank you to our nation's heroes. And then in terms of use, this test is now being adopted globally. And what better way to showcase that than just highlight that these tests are being put into global guidelines. They were recently put in the American College of Rehabilitation Medicine's guidelines, draft guidelines for use. They were put in the Spanish consensus statements, the Portuguese for Portugal, their consensus statements. It's being adopted into South America. It's so I could go around and start naming continents and places in the world, but let's just say we're getting global adoption, and it's really exciting. You can see why. It's an objective test with the highest scientific rigor that can help you help your patients. And in terms of future plans, we always have big plans. So even though we've come out with these two amazing devices with two amazing sets of tests, we always want to do more. So we're looking at pediatric claims, the use in children. We know that the literature is very promising, that these brain biomarkers do look like they indicate if a pediatric or a child is okay or if they've sustained injury. So we're certainly looking at that. And then now that we have a rapid, objective way to assess whether brain injury has occurred and how severe it can be, we're naturally going to be looking at treatments. We're looking at partnerships for prevention, because the best problem is no problem, right? So a whole host of things. There are also potential treatments involving nutrition, nutraceuticals. We know that that's very important for the brain. Different types of exercise, scaling up. How do we get people to recover? All of that is so important. And another huge area that we're really digging deep into is looking at the effect on women versus men. So we know that female athletes have a higher rate of concussion in contact sports than male athletes and tend to have more post-concussive symptoms. That's huge news. That's very important. So we are really doing a deep dive on that and seeing what we can do to help in that space.
Thank you. And do you have any practical advice for clinicians or other healthcare workers who are interested in bringing this technology to their hospitals or their facilities?
Oh, absolutely. So you can check out, there will be links in the description of this podcast that people can refer to. And then for concussion awareness information, if you have a pen ready, everyone listening out there in the podcast world, you can go to concussionawarenessnow.org, and that will be in the links as well.
Thank you. And so before we close, I just want to ask, is there anything either one of you want to add that we perhaps didn't cover in our discussion today?
With this new blood test, what we've done is make the impossible possible and the invisible visible so that we can optimize healthcare for patients globally. And remember, guys, the best problem is no problem. Prevention is key. Wear your bike helmets, right? Install those hand railings. If you're always tripping over the rug, fix that, because you don't want to have a brain injury. And guys, put your cell phones down when you're texting and crossing the street. And if you're using those e-scooters, slow down and wear a helmet.
One of the things that excites me the most is the value that this will bring to patients themselves. There are so many patients who have sustained a traumatic brain injury and don't get a proper diagnosis. And then there's a whole host of other patients who know they have a problem and are seeking the clarity and seeking the answers for what they know is wrong with them. I'm very excited for this change in clinical practice where we are going to have a blood test that helps us help the patients. We know that traumatic brain injury is one of the most common diseases in the United States on an annual basis. We also know that traumatic brain injury doesn't discriminate. It doesn't discriminate across gender lines, racial lines, socioeconomic lines. We have to remember that it is frequently the most vulnerable members of our society who are at the highest risk for traumatic brain injuries. Bringing to clinical practice tools, technologies, tests that are going to allow us to help everyone is the most effective way that we can improve public health.
Dr. Okonkwo and Dr. McQuiston, thank you so much for your time today and sharing your expertise with us in evaluating TBI.
Thank you to Dr. Beth McQuiston and Dr. David Okonkwo for sharing their knowledge with our listeners in this episode of Neurology Disease Deep Dive. And thanks to you, our listeners. In an exciting update, Abbott also recently received a new clearance from the US FDA for its iStat TBI test cartridge. The cartridge is now cleared to be used with whole blood, which means it can now be used at the patient's bedside or even in settings outside of the hospital, like urgent care clinics. The clearance also extends the testing window to 24 hours, which provides more time for people to get the test. Find more information about the approval in the link in the description. Be sure to visit practicalneurology.com for more podcasts in the field of neurology. This episode of Neurology Disease Deep Dive is brought to you by the editors of Practical Neurology and sponsored by Abbott Laboratories.